Guyana and several countries around the world are on an ambitious campaign to end AIDS by 2030. However, the National Advisor on Health, Dr. Leslie Ramsamy, is of the view that AIDS can be eliminated way before that timeline, with the right efforts being channeled behind initiatives to limit the spread of the disease.
We have let that ball drop a little bit. We have to amplify it again because HIV is still with us. And here is the truth that we can end AIDS today. I'm talking about AIDS, not HIV. A person living with HIV and receiving treatment don't have to have AIDS.
Dr. Ramsammy explained that the existing treatment available for persons living with HIV/AIDS and the country's ability to identify individuals living with HIV and prevent them from developing AIDS are just some of the essential steps that can keep the country on track to bringing an end to AIDS.
But that means we mustn't have antiretroviral shortages. We must be able to take it out to the community, etc. We have to destigmatize if we want to end HIV.
One of the successes recorded by the National AIDS Program Secretariat in 2021 is a 1% decline in new HIV infections. NAPS in December last reported that in 2021, the HIV infection rate was 1.3% when compared to 1.4% from the previous year. In excess of 71 persons were diagnosed with HIV in 2021. To date, a few countries have achieved the UNAIDS 90-90-90 targets, which outline that 90% of all people living with HIV should know their HIV status, 90% of all people with a diagnosed HIV infection should receive sustained antiretroviral therapy, and 90% of all people receiving antiretroviral therapy should have viral suppression. In Guyana, 94% of persons living with HIV are aware of their status, 70% are retained on antiretroviral therapy, and 83% are virally suppressed. Temika Rodney reporting for the HGP Nightly News.